Doc Talk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us today on Doc Talk. We are going to have a great show. We have Dr. Brian Payne joining us today, and we're going to talk about compounding products, pharmaceuticals for livestock and other industries. It's going to be a great show. We're glad you joined us, and stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to Doc Talk. I'm Dr. Dan Thomson, and we have Dr. Brian Payne with us. Dr. Payne is a veterinarian, and he is the Director of Research and Development and Technical Services for Veterinary Pharmaceutical Solutions. You know, we're going to talk about something interesting today. For me, it's something that we've used for many years, but now as we have better capabilities, it's something that's really fun and something that's very beneficial to our industries to use, and that's compounded products. So Dr. Payne, I'm going to ask you first, just kind of give us compounding 101.
Sure. Well, first of all, thanks for having me. Really appreciate it. Excited to talk about compounded products. Compounding pharmaceuticals are drugs that we start with an approved drug. In livestock and poultry, it's an FDA approved drug. Mm-hmm. We change the format of it so that it's more applicable to the livestock species. It's different from manufactured products, pharmaceuticals, in which they start with an active pharmaceutical ingredient that's bulk, and then they make it into an FDA-approved product, which can be administered. So this, we're already taking an FDA-approved product, changing it so then we could administer, maybe it's an injectable, maybe it's a pour-on, maybe it's water-soluble, and that's where we specialize.
Yeah, and so this is something that's already been approved, and now we're just taking it into something that, instead of something that's for a goldfish, something that might fit for a cow.
Yeah, absolutely. So there's limited amount of resources that are being spent on livestock today on new pharmaceuticals, but there's a lot of really good pharmaceuticals out there that veterinarians want to use for livestock. There's a right way to do it, and there's regulations behind it. But if we can take those active ingredients from FDA-approved products, get them into the format, you have a whole nother tool for your producers.
Yeah, and it makes perfect sense. You know, what are some of the things out there today as far as some examples of compounded products that people might think?
Yeah, I think one that's probably very interesting for the cattle side is meloxicam. Yeah. So meloxicam, being an oral suspension, can be easily drenched or put through the drinking water. There's ivermectin that can be put through the drinking water, or even antibiotics like florfenicol.
Yeah, and you know, when we sit there and think about mass treatment, or we use feed additives, to be able to not have to run an animal through the chute, or when they come through the chute, maybe not one less needle prick, in a different way of administering that solution. Quite a few opportunities, I would think.
I think there are. So it can, if you're putting it through the water, it can minimize handling, which is always a positive. And also, if you need to choose a drug that's different. So let's take anti-inflammatories, for example. Anti-inflammatories, there's several that are out there, injectable, that you could utilize. But meloxicam, it's a different type of anti-inflammatory. And now you have the ability to compound this drug or buy it from a compounding pharmaceutical company and administer it and have a different profile for that anti-inflammatory.
Yeah, when we see meloxicam, for those of you who don't know, it's a non-steroidal anti-inflammatory drug that we can use just like aspirin, flunixin, dexamethasone, and it has a longer duration in the animal. And so it's approved in other countries and other species, and great product for cattle. And so through some of the procedures that we're going to talk about today, we can get these products out and get them on the market. So thanks for being here.
Absolutely. Thanks for having me.
You bet. We're going to take a break. When we come back, more with Dr. Brian Payne.
Hi, I'm Sydney Tuckwiller, and I'm a territory manager at Neogen. Today we will be discussing taking a tissue sample to send in for DNA analysis. Taking a tissue sample is as easy as tagging a calf. Taking a DNA sample for analysis is designed to be as easy and convenient for the producer as possible. Samples can be taken as a hair, blood, or tissue sample, but tissue sampling units are the recommended method. Here are 4 easy steps to collect a sample on your operation. First, choose which sample type works best for you. Second, order your sampling equipment, whether it's a TSU applicator, TSU tubes, blood cards, or hair cards. Then, collect the samples and send to either your respective association or directly to the Neogen laboratory, which works with more than 60 different associations. DNA will process for an average of 3 weeks, and then you will receive your results. You can collect samples at any time, but it is recommended to take them sooner, such as around birth, to allow time for the samples to be shipped to the lab and results to come back soon enough to have time to make decisions using the results. Genomics is an accessible technology that plays a pivotal role in cattle production to enhance genetic progress in a herd.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Brian Payne, who is the Director of Research and Development and Technical Services for Veterinary Pharmaceutical Solutions. You might see it as VPS out there, but a company that we work with, outstanding track record in quality medicine. And Dr. Payne, when we sit there and talk about compounding, let's get into some of the, we talked about what it is, but now what are some of the things that veterinarians have to do or we have to do to use them in livestock?
Sure, absolutely. So once a veterinarian gets their license, they have the full ability to compound themselves if they want to, or a pharmacist can compound. Those are really the 2 options.
Okay.
So a producer can't compound on their own. That's one thing. And then there's legal framework for this. The FDA's written out regulations through the 21 CFR 530. That's the regulatory package that this falls under. We oftentimes talk about AMDUCA. So that was a law that was passed back in the 70s, giving veterinarians the right to use extra label and compounding products. And there's a whole bunch of regulations under that. Some of the things that are very important for livestock species to understand is we always have to start with an FDA approved product. We can never use bulk ingredients.
Okay.
So that's very important because the FDA has already approved that product. And then once we start manipulating it or compounding those drugs, we have to follow procedures to make sure that that's cleanly done. And I think it's also important to understand that we go through a QA/QC process. So batches that are then compounded, we actually want to check to understand, did the potency we say is in there, is it actually in there? So we go through analytical methods on our batches to make sure that If you're supposed to get that 15 milligrams in a milliliter, that's what you're getting of meloxicam. We're also inspected by the FDA. Okay. And so I think people that are unfamiliar with that is going, same thing with veterinarians. If you're compounding and you're passing drugs through your hands, is that you're inspected by the FDA or potentially inspected by the FDA. And then, of course, being a pharmacy, we have to follow all the state's boards of pharmacy regulations.
So, I think that's something that you just keep sticking. This has to be a FDA approved product
that we start with. Yep.
Yeah. And so, we don't think of that. When back in the old days, we'd think of compounding as a barrel of something coming in from, somewhere, and we're doing something that, there's a lot to the quality and the regulation of this in our industry.
There is, and there should be. Yeah. Absolutely. So you can think of it today. A lot of people are compounding meloxicam by putting in gel capsules, right?
Right.
They're taking the FDA-approved meloxicam, putting it in capsules, taking that time. They're starting with an FDA-approved product.
Yeah.
We start with a similar product that's FDA-approved. We just put it into a suspension that you don't have to capsulate, that you can just give it. So it is regulated highly.
Yeah. So this is a FDA regulatory process, just like the products are approved.
It is. So it's especially for compounding, right? We go through a different process than FDA approved products. Yep. It's already gone through there. They tell us the processes that we have to follow and then inspect them.
Well, we're going to take a break, and when we come back, we'll talk a little bit more about how they're used, safety, and different things on compounded products. Dr. Brian Payne's here. Thanks for joining us.
In a world where every decision...
Cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeda's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimedaBiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson with Dr. Brian Payne. He's a veterinarian that I've gotten to know over the years, and tremendous insight towards veterinary medicine in livestock species and pharmaceuticals. He is with Veterinary Pharmaceutical Solutions, and he's the director of R&D and technical services for their company. When we talk about compounded products, when does a person make the decision to use them or not?
Sure. First, it's the veterinarian that makes that decision. So it is a prescription product, any compounded product. They're going to write the prescription for the producer to use. First, we want to follow kind of the AMDUCA decision tree. And what I mean by that is if you have a product that's FDA approved to use in that species for that condition in that route of administration, you should use that one. You should always use that one. And then you come down, is there an extra label product? So the same exact formulation, just into a different species, can you take that and utilize it in cattle? If you can't, then you can go down the decision tree to compounded products. And that's where our business lies. That's where compounding should be. Yep. And so is it the right species? Maybe you don't have a product. Is there another product for that species? And then if not, go for a compounded product that we can manipulate so that we can properly give that dose.
Yeah, and when you think about it, there's, major species and minor species, and And some species don't get anything approved hardly.
Yeah.
And so, we're left to the design of using compounded products.
Absolutely. We are.
And then, when you think about this, and we've talked about the regulatory side, but what about withdrawals and how are those established with compounded?
Sure. Compounded products, there's a zero tolerance for any residues in compounded products. And we have to keep that in mind, and it's responsible of the veterinarian to prescribe that with a withdrawal period. We help with that. So our R&D team, our pharmacologists, pharmacists, and myself, we help with that. Sometimes we conduct actual withdrawal studies to determine recommended withdrawals. We take samplings over time. We utilize the FDA algorithm, and we provide that feedback. We also use a lot of industry information out there. There's a lot of good information on meloxicam in cattle, for example, that can be utilized. Oftentimes, it's all based around the half-life of the drug.
Right.
So if you give, let's say, call 1 milligram circulating, how long does it take for it to decay down to a half? And we utilize that to help calculate those.
One of the reasons I really wanted to do this show was because I see this as a tremendous tool for us in veterinary medicine for cattle, hogs, chickens, turkeys, whatever. But there's two groups that I wanted to get out in front of. One was the consumer on the safety side. There's, it's an FDA approved product. We have a lot of knowledge about it, and now we use different tools to set the safety and the withdrawal times. And then the other one is for producers. We have a lot of people on the show that are cow-calf, stock, or feedlot producers, horse. They all own horses, dogs, cats, different things like that. And I want them to start to understand the efficacy side and the reason why we have these products, and talk to their veterinarian about using them, right?
Yeah, absolutely. If they have the chance to experience them, evaluate in their hands, does it meet their expectations, I think they'll be very pleased.
Yeah. So, understanding compounded products, we're going to come back and we'll wrap up with Dr. Brian Payne, but I really wanted everybody to hear this, get used to it, because it's something that's here and we're going to use for quite some time. You're watching Doc Talk. We'll be right back.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/doctalk.
You're going to get in stocker cattle, and it's hard to find enough of them from just one source. So you're mixing them all together. It's like the first day of kindergarten. I mean, your kids come home sick, and same way with these cattle. It's very stressful for them. They're usually eating a different ration than they're used to, and they're around different friends that they have never seen before. You know, it seems like whether you're raising smaller cattle or stocker cattle or starting cattle or to feedlot, our problems are still similar. It seems like it's BRD or pneumonia, the worst problem we have, or the most costly problem. And in my experience, Amplimune can be used at any time during that period to stimulate immunity and decrease inflammation.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Brian Payne. We're talking about compounded products. Dr. Payne is the Director of R&D and Technical Services for Veterinary Pharmaceutical Solutions, otherwise known as VPS. Walk me through. So we decided, hey, we're going to use a compounded product. What's the veterinarian and the producer doing from that point forward?
Sure, absolutely. It's really in the veterinarian's hands at that time in their clinic. So it's writing a prescription. They write us a prescription if they're utilizing us, write it to us. On that prescription, it needs its intended use, such as reduction of fever and inflammation, around stress perhaps. It talks about the dosing of it. Meloxicam might be 1 mg per kg, for example. The withdrawal period that we previously talked about, and then really to ship it out. And then the signature, just like any other prescription, it gets sent out directly to the vet, to the feedlot, wherever you want it.
And remember, there's two sides to a VCPR. The veterinarian's writing down what we want it used for and how we want it used, and the producer is agreeing to do it the way the veterinarian says.
Yeah, absolutely. And I've always seen that as my role is when I was in practice of following up. It's the education to the client, talking to them about how to use it, following up with it and how did it work, and then making sure they use it the way you want them to.
Absolutely, absolutely. So let's talk a little bit about some of the products. We have some time. I want to get into some of the products that you have for cattle and some things that you see coming.
Sure, absolutely. I think of 3 right off the top of my head. Certainly meloxicam. There's a suspension that can be orally drenched. There's also a water soluble. If you're set up for water soluble delivery or into a tank, that can be utilized. It's nice that you make it up and leave it for the day. And
again, meloxicam is used as a fever and pain relief and different things to that nature.
The next one example I'll use is florfenicol. Our product happens to be ultraflor. I think there's florfenicol that's injected, but sometimes you can't handle all the cattle. Right. And sometimes this is an option that you can put into the water and you can receive the response from the lot. That one I would consider as well.
Yeah, and we start thinking about florfenicol, you think about products that we have that are injectable. We have other antibiotics that are feed additives, and this gives us an opportunity for something that's water soluble.
Yeah, absolutely.
Yep.
And the third one I would think about would be ivermectin. Our product happens to be Iversol. Again, through the water, the drinking water, it's the ability to treat internal parasites through the drinking water.
Yeah. So I think at the end of the day, really starting to see the pattern of how do we be able to use some of these products more strategically versus, if they're going through the chute, use, products that are available, products that aren't available, products that are more strategically used in places where we don't have to handle the animals. These are just things that we're looking for ways of ease of administration.
Yeah, it gives you a whole nother set of tools to utilize.
Yeah, absolutely. Well, any final words on compounding or thoughts?
No, I talk to the veterinarian. Producers, talk to your veterinarian out there. Veterinarians talk to us about there. Understand if you need to help understanding the pathway to use it, just give us a holler. We're glad to talk about it.
That's great. Thank you for being on the show.
Yeah, absolutely. Thanks for the invite.
You bet. Thanks for watching Doc Talk. Remember, always work with your local veterinarian. And if you want to find out more about what we do, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson with Dr. Brian Payne, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.